Hi, this is Elliot Fishman, and welcome to the December 2019 CTisus quiz. It's December. That means RSNA is going on. It also means this is the last quiz of the year. 12 amazing quizzes, and you can see all of them and all the information online at CTisus.com or on our app. And the new version of the app will be out in January 2020. That sounds very weird, but it will be there then. Okay, I have 10 great cases for you, so let's get started. On this first case, beautiful cinematic renderings. I'm looking at the anterior chest wall from behind. I have arrows pointing to a vessel. What is that? I gave you 4 choices, but there's only one choice. That is the correct answer. Those are the internal mammary arteries. Just beautifully shown on this CT scan. Again, cinematic is really good for looking at the detail of muscle, and you can see this on our new app of the chest using cinematic rendering, which will be in stores soon. The most likely diagnosis in this case, this is kind of just a nice example, but I showed you this. This is a classic type A dissection, nearly down to the coronary arteries. Beautiful differential enhancement of the true and the false lumen. The ascending aorta is dilated, and this only went into the proximal arch, but a beautiful example of a type A dissection. And this patient had repair and did fine. But you can see the danger and the importance of CT in looking at type A dissections, trying to find precisely where the dissection goes and how close it comes to the coronary arteries. The most likely diagnosis in this case, well, when you look, you see multiple enhancing lesions in the pancreas. So you can say, well, this could be multiple neuroendocrine tumors in a patient with an MAN1 syndrome, let's say. It's not going to be hemangiomas, obviously, and it's not going to be mucinous tumors. But what you notice here is the liver rotates posteriorly, the bowel falls posteriorly. This patient has had a right nephrectomy, which means the patient had a renal cell carcinoma, and these lesions are all hypervascular lesions or metastasis to the pancreas from clear cell renal cell carcinoma. We've spoken about this before. What's most interesting is that the pancreatic mets happened nearly a decade or more after the original presentation of the patient's tumor. A very unusual recurrence, but we see that not uncommonly. The most common metastasis to the pancreas is from renal cell carcinoma. A couple good facts. In this case, I asked you what's the best diagnosis. You're looking at a coronal view and a cinematic view, and what you notice is the pancreas is enlarged. You can see, particularly on the cinematic, the textural changes by the distal body and tail, and there's a halo appearance around it. This is classic for autoimmune pancreatitis. It's not pancreatic cancer, and it's not lymphoma. I guess you could say it's acute pancreatitis, but the halo takes it from acute pancreatitis to autoimmune pancreatitis. We need to be precise in CT these days. Just a beautiful example. The best diagnosis in this case is, well, what do we see? There's a large mass in the right breast. There are subcutaneous nodules. There's axillary nodes. There's right hilar nodes. There's also a mass in the left breast. I guess theoretically you could say metastatic melanoma, and in theory you could say lymphoma, but this is a female, and with the multiple nodules, with the masses by the internal mammary, the best answer is going to be metastatic breast cancer. But I guess I got to give you partial credit if you put down melanoma. I have seen melanoma look like this, and I have seen lymphoma as well, though less commonly. In this ER patient with abdominal pain, what's the best diagnosis? And what you can see here is the stomach is well distended. There's a metastasis or a mass in the liver, and diffuse infiltration of the body and antrum of the stomach by carcinoma. I'm showing you this case to make the point that when you're doing ER patients, you have to distend the stomach. If the stomach wasn't distended, you might miss this lesion. So whether you're using positive contrast or water for a neutral contrast agent, ER patients need a distended gastric fundus, body, and antrum. 1,000 cc's of water over 20 minutes, or at a minimum 500 cc's 5 minutes before, is going to solve the problem. Just do it. In this febrile patient, the best diagnosis is, when you're looking at the axial images, you can see the gluteus medius muscle looks enlarged, and there's high density within the muscle. There are ovarian cysts, and there's fluid in the uterine cavity. And then when you look at the cinematic, look at the differential enhancement and texture changes in the gluteus medius muscle. The muscle's enlarged, increased attenuation zones present. That's not the appearance of an abscess, plus bilateral abscesses and following the muscle planes would be unusual, to say the least. It's not lymphoma because it's too symmetric. It's not necrotizing fasciitis because we don't see air, and that's typically, you're going to see some air or tissue necrosis. It's myonecrosis, myositis, myonecrosis in that spectrum. Just a beautiful, beautiful example. I asked you the key finding in this case in what organ? Well, the key finding is look at the adrenal glands. Look how bright they are. There's periportal edema. There's a little bit of ascites. This patient is in shock. The patient's hypotensive. Classic appearance. Very bright adrenal glands without mass effect in any of the limbs. That's classic for hypotension. A very important diagnosis. In many cases, we can make the diagnosis before the clinicians are aware of the diagnosis. The liver lesions in this case are most likely, well, one thing you can see, look at the Ho image. There's a large mass in the tail of the pancreas that's enhancing. It's solid and it's cystic. Now you say there's lesions in the liver, so I know they're going to be Mets. And they're going to be Mets from that tail of pancreas tumor, which make it a neuroendocrine tumor. Now, if I didn't have the pancreas, I still would worry about metastasis. It doesn't look like FNH because there's sort of rim enhancement and central low density. It's not hemangiomas because you don't have puddling. Theoretically, it could be multifocal hepatoma, but the patient's liver is not cirrhotic, and this was a metastatic neuroendocrine tumor of the pancreas. The patient has an acute abdomen. What's the best diagnosis? The key finding is air within the hepatic veins. Beautiful example, axial and coronal. When you see air in the hepatic veins, you better be thinking about ischemia and infarction. Yes, I can see it post-procedure like a biopsy or ERCP occasionally. You also notice here the patient's right colon has pneumatosis. That puts it all together. Pneumatosis, air in the hepatic veins, classic for ischemic bowel. This is not hepatic infarction, and it's not bowel obstruction, it's not a liver abscess. This is ischemic bowel. Just a beautiful example. So with that, I give you 10 cases, and it finishes up the year. Now, I wish everyone a happy and healthy new year, but I also recognize some of you may not be watching this for another 3 or 4 months. So whatever month you're in, may you have a happy and healthy that month. Have a great day, and we'll see you January 2020. Bye.
If you liked what you heard here today, please make sure to hit that subscribe button and visit our website CTisus.com for lectures, quizzes, pearls, and more. Also, be sure to check out our apps that are available for free on the Apple Store. All links are in the description box below.